Anyone who has experience, there are different types of discs. There are air dried discs like what ophthalmologist has. There are also cryopreserved discs that have similar properties. They're made differently. They're a different type of device, but the indications overlap completely. If some folks who have experience with one type, they say, well, it's only this type, the other type doesn't work. It's not true. They both work. But what I think of when I think of those two classes of graft, I think of them, they reimburse the same way. The cost of goods is totally different. One's much higher than the other. The air dry tends to be much lower cost for the provider, while the reimbursement for the two comes in the same. Now, while that's not the main factor, that's a factor, right? Practice management is a factor. So the way I think of them almost like as if I was thinking of two different eye drops. There's an eye drop called Durezol, there's an eye drop called Lotemax. They're both topical steroid eye drops. They are classed the same way. They have overlapping indications. The proposed mechanisms of action overlap, greatly as well. But if I ask another provider, are you a Durezol practice or a Lotemax practice? Most of the time they'll tell me that's a silly question. We use a lot of Lotemax because for most patients, most of the time, that's going to do what we want to do well enough with a greater, with probably a better safety profile, less chance of raising the patient's eye pressure. But there are patients who have a raging uveitis and they need Durezol, and they should have it, right? The side effect profile for that product is different. They have a higher chance of getting a significant increase in eye pressure in a short time. But the folks who need it should have it. And that's kind of how I think of the two classes of grafts. The air dry is going to work well enough for most people most of the time, especially if you identify appropriate candidates and you're able to initiate treatment earlier in that disease state continuum, you're going to get the results that you want. Folks who have more advanced disease state presentations, or they can't suspend their, let's say, glaucoma drops for a few days, things like that, should have the other product, and thankfully that product exists.